The NHS Race and Health Observatory was established in 2021. We exist to help make sure that people of all ethnicities receive the same quality of care from the NHS. We do this by listening to the people who experience this inequity, producing evidence and supporting practical change on the ground. So, what have we achieved so far? The observatory was launched in April, 1 year into a pandemic which was disproportionately impacting ethnic minority communities. We began our work immediately, engaging stakeholders on our key priorities and producing infographics combating misinformation about the COVID-19 vaccine. We established our board, a stakeholder engagement group, and expert working groups. Soon after, we released our first research report, an exploration of racial bias in pulse oximetry. By June, we were producing new research on ethnicity coding and systemic inequality in the NHS and commissioning much more. Over the summer of 2021, we asked the public about the kind of language we use as an organization. More than 5,000 people got in touch and helped us develop new terminology we now use across our work. At the same time, our social media following began to grow. In the autumn, we began to see the impacts we were having when the Secretary of State for Health and Social Care announced that the government would commission a review to explore racial bias in medical devices. Not long afterwards, the National Institute for Health Research announced funding worth more than £500,000 for projects exploring this issue. Elsewhere, December also saw us signing a bilateral agreement with the American Center for Disease Control and Prevention, a major step for our international collaboration. On Valentine's Day, we released our rapid evidence review looking at race inequity across our key priority areas. Over the year, we've launched more than 15 programs of work, been featured in more than 600 articles and interviews, and have grown our following by more than 8,000 people. Our next step is implementation, helping the NHS make real-world improvements based on our research. Read our first-year summary report to find out more and join us to make racial health inequality a thing of the past.